Before we bring on our speaker for today, Dr. Hull, I want to welcome the new director of the Meharry Vanderbilt Alliance, Dr. Consuela Wilkins. She is leaving her position as Associate Professor of Medicine, Psychiatry, and Surgery at Washington University in St. Louis. She's the new director of the Meharry Vanderbilt Alliance. We're delighted that she was able to be here today for our April meeting, because she actually doesn't start on the job until June 1, but she's so eager to be here that she's here with us now. So I've asked her to say a few words to the group as the incoming director of the Vanderbilt Meharry Alliance.
And I am so delighted to be here. As Velma mentioned, I'm leaving St. Louis and don't officially start until June, but wanted to start to learn more about the Nashville community and some of the networks and coalitions that we'll be working more with as the Alliance changes its focus some to be more involved with community engagement. And I want to thank the Alliance staff for coming out this morning as well. If you don't know much about the Meharry Vanderbilt Alliance, it was formed in 1999 as a partnership between the two institutions, and really the idea was that there would be more of an infrastructure for collaborating. A lot of that work is focused on education and training. There has been some research, but now we're going to turn and focus more on community engagement and community engaged research, which I'm extremely passionate about. That's what most of what I do at Washington University is involving community engagement. And that's because I believe the only way we're really going to address some of the most challenging health disparities is to do it collaboratively. And if we don't involve the community in a substantive way, we're never going to do that. We also have to make sure that we continue to recognize that health doesn't occur in isolation, so health conditions don't occur in isolation. So I think it's great to see such a wide variety of organizations represented here to work together to solve some of these challenges that our communities face. So I'm really excited to be here and look forward to meeting all of you and hopefully working closely with many of you. Thanks.
Thank you. Dr. Pamela Hull is going to be presenting part one of two series today on social marketing for public health. And it's a presentation of the overview of community-based prevention marketing model, which combines social marketing and community-based participatory research. And what will be presented to us is an example of how that's been applied, developed, and tested in a public health intervention. Dr. Hull is an assistant professor of medicine at Vanderbilt University. She's a medical sociologist with expertise in the development and testing of behavioral interventions to promote cancer prevention behaviors. She has 7 years of experience conducting community-based participatory research and is going to share a lot of that level of expertise as she's presenting this session today. Welcome, Pam, and we're glad you're here.
I'm going to give an overview of this today, and and the examples we'll be giving are from two collaborative projects between Vanderbilt and Meharry and TSU, part of the Meharry Vanderbilt TSU Cancer Partnership, and these two workshops we're offering as part of the Cancer Outreach Corps to increase community capacity to be able to collaborate on this type of research with community partners and academic researchers working together to develop and test public health interventions. So we hope that this will inspire more partnerships and more collaborations, either using this model or other approaches, but this is one approach that may appeal to many organizations that are here today. And I may have known some of you before I came to Vanderbilt. I worked at TSU for many years, so we have a strong collaboration across the three institutions. So if you've come to any of these breakfast meetings before, you've probably heard about community-based participatory research already. And if you haven't, I'll just briefly give an overview of that. So community-based participatory research is different from our traditional research approach, where that's sort of a top-down. The researcher is the expert in the area, and they say, this is what we have to do, and go to the community, and we need you to do this for us, and give us we're going to collect data from you and leave. They publish in their scientific journals, and nobody in the community ever hears about it. That's sort of the traditional model that happens a lot. And sometimes there are reasons where it's not even appropriate or relevant to involve the community in some types of research, but we want to really promote engaged research and to the extent possible, as much participation of the community whenever possible in research. So the sort of ideal model is where community members and community organizations partner together with researchers to develop research questions, to identify some issues in the community that are important to the organizations and to community members, and try to address those issues through research activities that would be such as developing some type of program or policy that could be used to address those issues, and then doing research to test it and see how effective it is. So in that way, it combines research and social change. It's addressing some of the social issues in the community and some of the objectives that nonprofit organizations or public health organizations want to address, and also contributing to scientific knowledge and what are effective programs and policies. So we want effective community members, whatever the issue is, community members who are affected by that issue to also be involved in the process as much as possible. Not just the study participants, not just people we collect data from, but as part of an advisory board, as part of some sort of team, sometimes as part of the research staff even. So we'll talk about different ways. It emphasizes equal partnerships and reciprocal learning. Everyone at the table from different organizations, different areas have different types of expertise and different types of knowledge that contribute to the team, and everyone brings something valuable that we can all learn from each other. Different strengths. And also it aims to empower community members, like I said, to help diagnose what are the problems, what are the issues we need to address, prescribe how we're going to address them, implement those programs or interventions, and also evaluate them. So social marketing is one approach or one strategy to approach these issues. Social marketing draws on traditional marketing, what we think of every day in advertising on TV or radio, selling products. That's the typical marketing that we're aware of, that we are exposed to every day. And that's used to promote products, sell products, and generate profits, right? Well, social marketing is a little different. It applies the same principles, the same process to developing and disseminating messages, but instead of selling a product, it's aimed at either changing knowledge, attitudes, or behaviors for social benefit. Rather than profit, it's for nonprofit ends. And so it can be, a lot of nonprofit organizations, advocacy organizations use it for increasing awareness about an issue. Some use it to change attitudes about an issue. We're going to be focusing on behavior in particular. That's where it's often used in the public health area is to change behavior, but it's also used for knowledge and awareness. So as I said before, social marketing in the area of health is used by taking the strategies and techniques that we use in traditional marketing and applying that to be able to encourage specific changes in behavior, specific goals, behavioral goals. So that would be with the end of improving health, and we hope to also help reduce health disparity. That's where we always try to keep a focus on health equity. So we already said that. And sort of some key concepts to think about in social marketing is what we traditionally think about as the customer. And when you're selling products, our customer is your target audience, who you want to hear the message and change behavior. That's your audience or your customer. So that can be specific people, specific communities, patients. It depends on what setting you're applying it to. And then also thinking a very central part is behavior, a very specific behavior. It's a little different from some health communications approaches where we might be talking about a large issue and multiple components of cancer prevention or something like that. But with social marketing, you focus very specifically on one target behavior at a time. So we will talk about that and what the influences are of that behavior, who influences people in their behavior decisions, what incentives and barriers there are. So we'll talk about those things some more. There are some common misunderstandings about social marketing. It's not just commercials for the public sector. It's not just about developing commercials. It's a little different from, like I said, some other health communications approaches. There are similarities, but there's also some differences. It's not just advertising about social issues. It's not about just telling people what to do. We're not just focusing on individuals, as was mentioned a moment ago. It's looking at individual in a larger context of community and social structures. We also have to be careful about unintended consequences of social marketing, just like any other marketing, so you also have to be aware of that. It's whenever possible, it shouldn't be a top-down approach. We, especially in this model that we'll talk about today, it encourages community collaboration so that it's more of a bottom-up approach. And we hope it's not just a passing fad. So basically, as I said, it's using marketing for social benefit. In this case, we're focusing typically on health, improving health outcomes. And so the specific approach that we'll discuss today is on your handout. This model sort of outlines the steps. And as I said, Carol Bryant and her colleagues developed this model at the University of South Florida, and she will provide some more in-depth explanation of some of the steps when she comes. So there are 9 steps in the model, and we will go over those today. Basically, it combines these two things. It combines participatory research and it combines social marketing in a way that you do the whole social marketing process together in a community academic collaboration to develop and to test public health interventions. And when we say interventions, that's sort of a technical word. It's just any kind of, it can be something in a clinic setting, it can be a program in the community, it can be a policy change. That's sort of a broad term. So it depends on what the issue is that you're focusing on and what strategies you choose to use. So let's go into the process. And I try to avoid technical researchy terms, but if I forget and use them and there's something that's not clear, please raise your hand and I'll explain it more clearly. I know that in different areas of work, everybody has their own sort of language, work language. So if I do that, please let me know. So the 9 steps, I won't read through these, but we're going to go through all 9 of these steps. And as I said, we're going to talk about some examples from a pilot project that we recently finished. They're both focused on HPV vaccine for cervical cancer prevention. In the recently finished pilot, we were focusing on Hispanic girls, and the new pilot that we recently started focuses on African American girls. The previous one, we collaborated with the National Latino Health Coalition and Progresso Community Center, and this one we have a newly formed community advisory board that is advising on that project. And so if anyone is really interested in this, we are also welcoming some new members to our board, so let us know if you're interested. So the first step is to mobilize community. And that can be done in different ways depending on what your focus is and who would make sense to work with in your community. So there may be an existing coalition of organizations that's interested in working on an issue. That coalition can move forward, or you may want to form a new coalition around an issue if it doesn't exist already in the community. Or it can just be a group of organizations, a more informal collaboration, a couple of organizations and researchers who want to work together, depending on what makes sense in the community. But the most important thing is that members of the population of focus should be involved. Organizations who work in that issue or who work with the population of focus should be involved throughout the process. And that helps to, on the one hand, ensure cultural appropriateness of whatever you develop, and also it should contribute to it being more acceptable and effective. Whatever is developed should be more acceptable in the community. This is an example of us working together in the National Latino Health Coalition. So you can see on your handout, we started working on this through the Meharry Vanderbilt TSU Cancer Partnership, so our focus was already on cancer in general. And as we looked at some of the health disparities in cancer, one of the issues, big issues that came up is cervical cancer affects both African American women and Hispanic women disproportionately, higher rates of cervical cancer incidence in both. There are some Tennessee and Davidson County rates on your figure as well, but there were no data for Hispanic women at the state and county level. We started this in 2007. There were basically no health data on Hispanics at all for the county. So we set out to do a needs assessment. We did a survey, Hispanic Health in Nashville survey, and just a highlight of a couple of the findings that we found to sort of describe that community that we were working with. Low levels of education. This community is a very high portion of recent immigrants from Latin American countries, which is different from, say, California, Florida, New York, where there's traditional, long history of immigrant generations. In those communities, we have a very new immigrant community here, so about 2/3 have less than a high school degree. This was out of a